Hello everyone, how are you doing? So today we'll discuss the second part of the anatomy of mandible. So the topic of discussion will be the attachments and relations of various muscles to the mandible. Okay, so first coming to the ramus of the mandible. So we will see which muscles are there which are associated with the ramus of mandible. So there are four muscles which are together called as muscles of mastication. Mastication matlab chewing, okay? The four muscles which help in chewing are called as muscles of mastication. So these four muscles, they are named as masseter, temporalis, medial pterygoid and lateral pterygoid. This will be discussed separately as a separate topic. For now, let's understand where these muscles are associated in the mandible, right? So first is the masseter. Okay, before coming to these muscles, let's understand one term, that is OINA. Okay, now what is OINA? When you will study about the various muscles, the muscles are described under this term, OINA. So what is OINA? OINA means O stands for origin, I stands for insertion, N stands for nerve supply and A stands for action. So whenever a muscle is studied, जब भी हम कोई मसल को स्टडी करते हैं तो उसका जो स्टडिंग होती है वो that happens under these four headings, these four separate headings: origin, insertion, nerve supply and action. अब इसका मतलब क्या होता है? Origin मतलब the part from where that muscle is originating or the part from where that muscle is starting. I is for insertion. Insertion means कहाँ पर वो muscle end हो रही है, the part where the muscle is ending. Nerve supply means the nerves which are supplying that muscle, and A for action. What is the action that particular muscle is causing or helping with? Okay, so I stands for insertion, right? यहाँ तक clear है? Now coming to masseter. Okay, so if you see this diagram, this is the ramus of the mandible. Okay, this is the ramus of mandible and this is the lateral surface of ramus of mandible. Lateral surface मतलब बाहर वाला surface, right? This surface, बाहर वाला surface. Okay, so this blue muscle is the masseter. Okay, this muscle is the masseter. So if we see this diagram, masseter is inserted. Okay, masseter is inserted, not origin. Inserted मतलब यहाँ के खत्म हो रही है. Okay, so masseter is inserted into the lateral surface of ramus. So this is the ramus and this is the lateral surface of ramus. So masseter is inserting into the lateral surface of ramus, but except the posterior superior portion. Okay, this is the posterior part of the ramus and this is the superior part. So posterior superior part को छोड़ के बाकी portion में ramus, the masseter muscle is getting inserted, right? So masseter is inserted into the lateral surface of ramus except the posterior superior part. Okay, now what is there in the posterior superior part? So the posterior superior part is covered by this structure, this triangular structure. I haven't drawn it there, I have drawn it here. This triangular structure is parotid gland. Okay, so first point is masseter. Masseter is inserted into the lateral surface of ramus except the posterior superior part. Second point is posterior superior part of the ramus of mandible is associated with the parotid gland, or it houses the parotid gland. Okay, as you can see here, the ramus has been made in dotted lines and the parotid gland is over this ramus. Okay, so this is the parotid gland. Okay, next coming to the temporalis muscle. Okay, so temporalis muscle is inserted into the apex and medial surface of coronoid process. So this red one is the temporalis muscle. You can see it here. It is inserted. It is insertion, not origin. Inserted into the apex and it extends downwards along the anterior border of ramus. So this dotted line is the anterior border of ramus. So this temporalis muscle is attached in the apex of the coronoid process and along the anterior border of the ramus on the inside. Okay, next is on the medial surface or inside. Okay, so the attachment is, the insertion is on the medial surface, not on the outer surface, on the inner surface. You can see it here. It is inside the coronoid process. Next is the lateral pterygoid. Okay, so there are two more muscles. One is the lateral pterygoid and the other is the medial pterygoid. So this orange one, this one and this one, these are the lateral pterygoids. Okay, upper head and lower head. This is divided into two parts, upper head and lower head. So this lateral pterygoid is inserted into the pterygoid fovea. If you remember from the first lecture, this is pterygoid fovea. Okay, so lateral pterygoid is inserted into the pterygoid fovea. Okay, now there is one more line which you should know. Here is the lateral pterygoid. In case of lateral pterygoid, origin is medial to insertion. इसका मतलब क्या है? Origin is medial to insertion. मतलब insertion बाहर side हो रहा है and origin is towards the inner side. You see this? The insertion is on the outer surface, but origin is behind this muscle. Okay, so origin is medial to insertion. Okay, now coming to medial pterygoid. See, this is again the ramus of the mandible. If we cut the ramus, okay, this is a cut portion or the section of the ramus. Okay, so we see that these red muscle fibers are going inside into the medial surface of the ramus. मतलब ये अंदर है. Okay, so medial pterygoid का insertion कहाँ हो रहा है? In the medial surface of angle of mandible. They are attached or they are inserted into the angle of mandible, but from the inner side. Okay, so medial pterygoid is inserted into the medial surface of angle of mandible below and behind the mylohyoid groove. If we remember from the last video, the mylohyoid groove was somewhere here. Okay, mylohyoid groove. So it is below and behind the mylohyoid groove where it is inserted. Okay, so these four muscles, I hope it's clear. One more muscle we will deal here only, that is platysma. Okay, platysma is somewhere here. This one, this muscle. Okay, this muscle is platysma. So here you can see platysma is present or inserted along the whole lower border of the mandible. This red one is the platysma. Platysma is inserted along the entire lower border of the mandible. It will carry it like this. Okay, it will be carried like this. Okay, so we have done 5 muscles: masseter, temporalis, medial pterygoid, lateral pterygoid and platysma. Now coming to the muscle attachments on the body of the mandible. Okay, so here are 2 diagrams through which we will understand the attachments of 4 muscles, right? So if you can see these 2 diagrams, this one is the lateral view, means view from this side. For example, this one is the view from this side and the mandible is cut here. Okay, this is a cut section of mandible, means the mandible will be like this, something like this. Okay, and this one, this view is from the anterior aspect. Okay, antero-inferior aspect, right? This is the view. If you see this, match this with this one, this is the view. Okay, this view. Okay, so first we are coming to upper genial tubercles. So if you remember that the genial tubercles are something that are present on the inferior aspect just behind the symphysis menti, right? So upper genial tubercles gives origin to the genioglossus muscle. Okay, so this one is the genioglossus muscle, this red one, this entire red muscle is the genioglossus muscle. So if you can remember, here is the upper genial tubercles, here is the lower genial tubercles, and this here is the digastric fossa. Okay, it was discussed in the last video. So upper genial tubercles gives origin to the muscle named genioglossus. Similarly, lower genial tubercles gives origin to geniohyoid muscle. Okay, now we talked about OINA, right? Origin, insertion, nerve supply, action, the 4 subheadings under which a muscle is studied. So see this, for example, this muscle, geniohyoid. This muscle is named based on the origin and insertion. See, origin is from the genial tubercle, so the first part is genio, and insertion is into the hyoid bone. This is the hyoid bone. Okay, this one is the hyoid bone. So the name is geniohyoid. Okay, so this big muscle is the genioglossus, this smaller one is the geniohyoid. So what you will write? You will write these 2 points. These points you will write. These are for your understanding. Okay, upper genial tubercles gives origin of genioglossus. Lower genial tubercles origin of geniohyoid. Okay, coming to this diagram, right? So this is the lower border, this is the outer surface. Okay, pardon for my diagrams, I tried my best. So if we see it from this aspect, like we are visualizing it from here. So the outermost muscle which we see is the anterior belly of digastric. Okay, so this muscle, anterior belly of digastric, it is originating inside from the digastric fossa. Okay, so here is the digastric fossa on the inside. These muscles are originating from here. The anterior belly, particularly the anterior belly, is originating from the digastric fossa. Okay, and there is, here it is a pulley-like structure. Pulley means you have seen the bore wells in villages used to fetch water. So there is a pulley. Also you have studied in physics also pulley. So there is this pulley-like structure in this hyoid bone. So these muscle fibers, one fiber is here and the other fiber is stretched over here. So this one is the anterior belly, this one is the posterior belly of digastric. So anterior belly of digastric is originating from the digastric fossa. You can see it over there also. You can see it over here also. This green one is the anterior belly of digastric. This one is the hyoid bone, and this is the pulley-like structure, and this is the posterior belly of digastric, right? So after that, or inside that, this big muscle, okay, this one, this muscle, this orange one is the mylohyoid muscle. So mylohyoid muscle originates from the mylohyoid line. So if you remember, the mylohyoid line is somewhere below these molar teeth in the inner surface. So here are the mylohyoid lines. Okay, these are the mylohyoid line like this. So these muscles originate from mylohyoid line. Okay, both sides. Okay, mylohyoid line gives origin of the mylohyoid muscle, right? So outermost muscle fibers is the anterior belly of digastric. Inside this is the mylohyoid, and if the mylohyoid is removed, on the inner side of the mylohyoid you will find a similar muscle structure like these two lines. That will be your geniohyoid. Means सबसे ऊपर है आपका ये anterior belly of digastric, उसके अंदर ये mylohyoid, उसके अंदर सिमिलर जगह से यहाँ पर है अपना inferior genial tubercles. From inferior genial tubercles to the hyoid bone, behind this mylohyoid or inside this mylohyoid, you will get the geniohyoid muscles. Okay, right? So next we will move to the muscle fibers, that are muscles that are associated with the mandible near the oral cavity or opening of the mouth. Okay. Now coming to the muscles on the anterior aspect. So important points are, these are the two diagrams. This one is for your understanding. Okay, this is just to illustrate the positioning of the muscles. Okay, you need not draw this diagram in your exams. You can take screenshots of all those diagrams which I have made in this entire lecture for your understanding, right? This is the diagram that you will make in the diagram. Okay, you will make in the exam, right? Now coming to the points and the muscles. First is the incisive fossa. Okay, incisive fossa you remember just behind beneath the incisor teeth. Okay, so the incisive fossa gives origin to mentalis and mental slips of orbicularis oris. So where is mentalis? This is mentalis. Okay, incisive fossa is somewhere here near this position. Okay, because incisors, lower incisors are placed somewhere here. So incisive fossa is a depression near in this region. So mentalis is originating from here. Okay, so origin of mentalis is from incisive fossa. Next is the mental slips of orbicularis oris. So orbicularis oris is this muscle. This circular muscle is the orbicularis oris. Okay, surrounding the oral opening mouth. Okay, so mental slip of orbicularis oris is also originating from the incisive fossa. Okay, next is the oblique line. Oblique line, as you all remember, on the outer surface there is this line, anterior continuation of the ramus of mandible. So oblique line gives origin to three muscles. Okay, now up to the anterior border of first molar. Okay, so up to the anterior border of first molar. So this is, for example, consider there is no third molar for now. So up to the anterior border of first molar, the buccinator muscle is originating from the oblique line. Okay, so how we will write? Oblique line up to the anterior border of the first molar gives origin to the buccinator muscle. Okay, right? Next is the below the mental foramen, means continuation of oblique line below the mental foramen. That part that part gives origin to two muscles. First is the depressor labii inferioris, second is the depressor anguli oris. So these 3 points you need to write in your exams, okay? And for your understanding, this is the positioning, this is the orbicularis oris surrounding the oral opening, okay? These two are the depressor anguli oris, okay? These two green ones are the depressor anguli oris, right? So this red one beneath the depressor anguli oris, okay? Beneath the depressor anguli oris is the red one. This one is the yes, beneath the depressor anguli oris is the depressor labii inferioris, okay? You can see it here also, okay? And this orange one, the last one, the most positioned inside, this one is the mentalis, okay? So this finishes all the muscles. So one point that I missed to mention is the pterygomandibular raphe. So pterygomandibular raphe is a muscular structure which is present just behind the third molar teeth. This one, okay? This red one is the pterygomandibular raphe, which is present just behind the third molar teeth, and it is continuous with the superior constrictor muscle of the pharynx. Means superior constrictor muscle, it is a pharyngeal muscle, it is a big muscle, okay? तो इसके बहुत सारे origins है, बहुत सारे parts है. तो one part is originating from the pterygomandibular raphe, this region, okay? Now pterygomandibular raphe, this part is a very important landmark for inferior alveolar nerve block, okay? This you will read in the local anesthesia chapter when you will study oral surgery in third year or final year. Now coming to the ligaments that are associated with the mandible, okay? So first is the sphenomandibular ligament. So sphenomandibular ligament is attached to the lingula, which is present on the medial or the inner surface of the ramus, okay? So this is the lingula, and this red one, okay, this red one is the sphenomandibular ligament. So you will write sphenomandibular ligament which is attached to the lingula. Second you will write is the stylomandibular ligament. So stylomandibular ligament is attached to the angle of the mandible on one side, and on the other side to the styloid process. This one is the styloid process, okay? Stylomandibular ligament attached to the angle of the mandible. Third one is the lateral ligament of TMJ or lateral temporomandibular ligament. This this particular ligament is attached to the neck or the constricted portion of the condylar process, that is the neck of the condyle, okay? So nerves and vessels related to mandible. This is the diagram that you will make, and this is the content that you will write, okay? So first is the mental foramen, okay? Mental foramen transmits the mental nerves and vessels. I forgot to mark it here. It will be somewhere here, okay? Between the two premolars. So somewhere here. So mental foramen will transmit the mental nerves and vessels. First important thing, this is the interior surface, okay, or the inner surface, okay? So the dotted ones, the ones that are marked in dots are present on the outer surface, okay? Since we are representing a 3D structure in 2D, so dotted marks are present on the outer surface, and those who are drawn in the bold lines, that are present in the inner surface, because this diagram is representing the inner surface, okay? So जो भी डॉट वाले हैं वो सारे आउटर सरफेस के हैं, ठीक है? तो ये भी डॉट होना चाहिए क्योंकि ये आउटर सरफेस पे है. तो मेंटल फोरामेन, फर्स्ट मेंटल फोरामेन क्या ट्रांसमिट करता है? मेंटल नर्व्स एंड वेसल्स, ओके? सो दिस विल बी इन डॉटेड, ओके? Second is the mandibular foramen. So this is the mandibular foramen. Mandibular foramen is present on the inner surface, so it is marked in bold lines. So mandibular foramen transmits the inferior alveolar nerves and vessels, okay? I have marked it here. This is the inferior alveolar nerve and vessels that is transmitted through the mandibular foramen, and they pass through the mandibular canal, okay? They are passing through the mandibular canal. Next is the mylohyoid groove. I always make a mistake. It is MYLO, not MYE. Mylohyoid groove. So mylohyoid groove transmits the mylohyoid nerves and vessels. So this is the mylohyoid groove just behind the mandibular canal. So mylohyoid groove transmitting the mylohyoid nerve and mylohyoid artery, right? So next is the lingual nerve. Lingual nerve is present just on the medial surface of ramus, okay? On the medial surface of ramus, in front of the mylohyoid groove. So mylohyoid groove is running like this in this region. It is the lingual nerve is present in front of the mylohyoid groove on the medial surface of ramus. It is present in very close relation to the mandibular molars. Okay, roots of the mandibular molars. Okay, next is the sigmoid notch or the mandibular notch. Okay, so sigmoid notch or the mandibular notch houses the masseteric nerves and vessels. They are present on the outer surface. Okay, outer surface, sigmoid notch or mandibular notch, masseteric nerves and vessels. Right. Next is the facial artery. So facial artery is present on the lower border of mandible here. Okay, facial vessels present on the lower border of mandible at the antero-inferior angle of masseter. So if you remember, masseter is present here. Attachment of masseter is here somewhere. In the last diagram we saw that. So at the antero-inferior, so masseter will be in this region. Okay, so masseter comes like this. This is the masseter. So antero-inferior angle of the masseter, it is present the facial vessels. The facial artery is present in the lower border of mandible at the antero-inferior angle of masseter. So you need to write these lines, right? So once again we will see the diagram now. So around the neck of the mandible is present the auriculotemporal nerve. Behind this posterior border, okay, there is external carotid artery. External carotid artery is branching to form the superficial temporal artery and the maxillary artery. Okay, again maxillary artery is giving branches. Inferior alveolar branch, ठीक है, उसके mylohyoid branch. Okay, this is the lingual nerve, this is the inferior alveolar nerves and vessels, right? Facial vessels are present on the outer surface, lower border of mandible, in front of the masseter, anterior-inferior angle of masseter. Sigmoid notch और mandibular notch में क्या है? Masseteric nerves and vessels. Okay, ये basic अपना structure है. ये diagram भी आपको बनाना है. Lingual nerve यहाँ पर in relation to the roots of the molar teeth, lower molar teeth. Okay, ramus of mandible में ये आपका बेसिक स्ट्रक्चर है. अब ये जो आर्टरीज एंड जो वस्कुलर सप्लाईज जो है, ये हम लोग इसके बाद जो टॉपिक आएगी स्कैल्प पढ़ेंगे हम लोग. ठीक है, स्कैल्प में दिस विल बी डिस्क्राइब्ड इन डिटेल्स. ओके, आर्टरियल सप्लाई ऑफ स्कैल्प में ये आएगा. ओके, so this finishes the nerves and vessels. Okay, next we will talk about the age changes in mandible. So ये थोड़ा सा ध्यान से देखना, बहुत इजी है लेकिन ध्यान से देखना, क्या नीट में भी इससे क्वेश्चंस आते हैं. राइट, सो एज चेंजेस इन मैंडिबल मैंने एक चार्ट फॉर्म में इसको कर दिया है. सो व्हाट आर द चेंजेस दैट टेक प्लेस? फर्स्ट एंड फॉरमोस्ट इज द मेंटल फोरामेन. पहले भी मैंने बताया था, तो मेंटल फोरामेन का लोकेशन चेंज होता है. राइट, सो चिल्ड्रन, एडल्ट, ओल्ड एज. ओके, तो मेंटल फोरामेन इन चिल्ड्रन इज नियर द inferior border. Okay, in adult it is between, in the midway between the inferior and the alveolar border. Okay, superior border or alveolar border. Okay, third is in old age it is near the alveolar border. Old age में क्या होता है? With the shedding of teeth, जैसे teeth झड़ जाते हैं तो with the shedding of teeth this bone also decreases in height. Okay, so the alveolar border resorbs. Okay, the alveolar bone resorbs, so the height decreases. So mental foramen becomes closer to the alveolar border. Okay, so suppose in normal case, in adult, suppose the alveolar border was here, but with age the teeth are shed, so the alveolar bone resorbs and alveolar bone height decreases. Okay, height of the alveolar crest decreases, so the mental foramen appears closer to the alveolar border. Okay, right? So next is the angle of mandible. In children the angle of mandible is 140 degree. Okay, in adult it is decreased to 110 degree. In old age it is again increased to 140 degree. Right, next is the coronoid process. So in children the coronoid process is above the condylar process. Okay, height of the coronoid process is more than the condylar process. In adults the height of the condylar process is more than the coronoid process. In old age again the same case is repeated, that is coronoid process is more than the condylar process. Right, last is the mandibular canal. Okay, so mandibular canal in children is near the inferior border. Okay, mandibular canal is somewhere like this. Okay, next is in adult. In adult it is parallel to the mylohyoid line in midway. Okay, so it is here. And in old age the mandibular canal is more closer to the upper border. Okay, so these four changes that you need to remember. It is important both for your first year also and for your NEET MDS preparation also. So with this we finish the topic of anatomy, mandible, anatomy of mandible. So the point is anatomy is a 3-dimensional subject. You need to visualize the structures कि structures कैसे है, बाकी structures के साथ आपके जो स्ट्रक्चर इन क्वेश्चन है उसका कैसे क्या रिलेशंस है, अटैचमेंट्स है, ये आपको तभी समझ में आएगा जब आप इसके 3D वीडियोस देखेंगे. तो YouTube में बहुत सारे चैनल्स ऐसे हैं जहां पर 3 डायमेंशनल वीडियोस अपलोडेड है. तो प्लीज वॉच दोज वीडियोस आल्सो एंड यूज दिस लेक्चर फॉर योर एग्जाम, फॉर राइटिंग द आंसर्स, कैसे लिखना है. ओके, आई हैव ट्राइड माय बेस्ट विथ ऑल दोज डायग्राम्स. 3D डायग्राम्स को 2D में रिप्रेजेंट करना थोड़ा मुश्किल होता है, बट आई हैव ट्राइड माय बेस्ट. तो आप इसको पढ़िए, उसके साथ और भी वीडियोस देखिए. देयर आर वेरियस अदर वेरी गुड एक्सीलेंट एजुकेटर्स देयर. तो दोनों को वीडियोस देखिए. एज आई ऑलवेज से, लर्निंग इज इंपॉर्टेंट. कहां से सीख रहे हो, द सोर्स इज नॉट इंपॉर्टेंट. आपको कंसेप्ट समझ में आना चाहिए. ओके, विद दिस वी फिनिश दिस टॉपिक. नेक्स्ट लेक्चर में मिलते हैं. तब तक पढ़ाई कीजिए, ध्यान रखिए. ऑल द बेस्ट. बाय बाय.